The sciatic nerve. The sciatic nerve is the longest and largest nerve in the human body. It arises from the lumbosacral plexus and has root contributions from L4 to S3. It is composed of two divisions, the tibial division, which runs medially, and the common fibular or perineal division, which runs laterally. Both are bundled together in a common sheath. It exits the pelvis through the greater sciatic foramen, passing beneath the piriformis muscle, and descends through the gluteal region into the posterior thigh. Here it lies deep to the gluteus maximus and superficial to the adductor magnus, running deep to the long head of the biceps femoris as it descends through the posterior thigh. Along its course, the tibial division of the sciatic nerve gives motor branches to the long head of the biceps femoris, semitendinosus, semimembranosus, and the ischial part of the adductor magnus. The common fibular division provides motor innervation to the short head of the biceps femoris. At the top of the popliteal fossa, the two bundled divisions of the sciatic nerve separate into their terminal branches, the tibial nerve and the common fibular nerve, also known as the perineal nerve. The tibial nerve continues vertically through the midline of the popliteal fossa, then descends in the posterior compartment of the leg. It gives muscular branches to the gastrocnemius, soleus, plantaris, popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. At the level of the medial malleolus, it passes posterior to it and beneath the flexor retinaculum, where it divides into the medial and lateral plantar nerves. These branches innervate the intrinsic muscles of the foot and provide sensory supply to the sole and toes. Additional nerves emerging from this region include the medial and inferior calcaneal nerves. The medial calcaneal nerve arises proximal to the flexor retinaculum, providing cutaneous innervation to the posteromedial aspect of the heel. The inferior calcaneal nerve, also known as Baxter's nerve, is a branch of the lateral plantar nerve. It provides motor innervation to the abductor digiti minimi muscle and sensory supply to the calcaneal periosteum and adjacent skin of the heel. Shifting focus back to the popliteal fossa, the second branch diverging from the sciatic nerve is the common fibular nerve. It travels laterally, along the tendon of the biceps femoris, then curves around the neck of the fibula. From there it splits into the superficial and deep fibular nerves. The superficial fibular nerve continues through the lateral compartment, supplying the fibularis longus and brevis, and then divides into two sensory branches, the medial dorsal cutaneous nerve and the intermediate dorsal cutaneous nerve, which provide cutaneous sensation to the lower lateral leg and the dorsum of the foot. The deep fibular nerve enters the anterior compartment, supplying the tibialis anterior, extensor digitorum longus, extensor hallucis longus, fibularis tertius, extensor digitorum brevis, and extensor hallucis brevis, and finally gives off its cutaneous branch in the web space between the first two toes. Additionally, another sensory pathway branches from the sciatic nerve, the sural nerve. It is formed by the union of the medial sural cutaneous nerve from the tibial nerve and the sural communicating branch from the common fibular nerve. Together they supply sensation to the lower posterolateral leg and the lateral side of the foot. In summary, the sciatic nerve supplies motor innervation to the posterior thigh and, through its tibial and fibular branches, to all muscles of the leg and foot. It provides sensory innervation to the posterolateral leg, dorsum, and sole of the foot, and the area between the first and second toes.